Of course. So a biliary atresia is a cholestatic liver disease that presents as l- collapsed bile ducts or missing or atresic bile ducts. So the bile ducts aren't active or aren't working. And so what ends up happening is instead of the liver secreting bile and all its chemicals through the bile ducts, it has nowhere to go. And so the liver becomes cirrhotic at producing all this bile and all these chemicals. And so the way it presents is that the indirect bilirubin is broken down by the liver to direct bilirubin, and then this keeps growing and growing and growing, and then the kids become jaundice. And so uh, once you see this jaundice, you have to test for fractionated bilirubin. And the reason I say that is the most common causes of jaundice are physiologic: breastfeeding, breast milk, just natural jaundice. And the majority of babies are jaundice. More than 60% of babies are jaundice. And so you most of the time it is not biliary atresia. But if it is biliary atresia and we're saying, oh, this is normal jaundice, it's physiological, we're not fractionating and we're missing the direct bilirubin, then the kid's gonna get worse. And the reason the kid's gonna get worse is by the time we say, okay, this is not physiological, find its biliary atresia, and let's say we're 2-3 months out and we want to do the Kasai. The Kasai is just in medical terms is the hepatoportoenterostomy, which means you're connecting the intestines directly to the liver, and you're praying the liver just dumps everything down through the intestines, and it works. But sometimes it doesn't, and as more time passes, the less likelihood of the Kasai working. I was once told every day in delay after 60 days is like an increase of mortality by 2% almost. And so if we're just saying, oh, it's jaundice, it's physiological, and we're not testing, and then your kid is the one in 15,000 that is the biliary atresia, you're not giving them a shot to survive and to do well. And if the Kasai doesn't work, then all your options are left are a transplant. And so at the end of the day, biliary atresia is rare, but it is one of the causes of jaundice that we should keep looking out for, because it is a dangerous disease and can be managed easily if caught on early. Oh, of course. So I think the crux of this project was that we still don't have an accurate measure to truly prognosticate biliary atresia. Like direct bilirubin helps us diagnose, MMP7 helps us diagnose. And so the question was, let's look at everything that's been published in the literature and try to see if like adding on all these studies, we can come up with serum values. There seems to be some cutoffs, like we know the threshold of bilirubin greater than 1 at birth, like within the first 48 to 72 hours of life, direct bilirubin is an indicator of biliary atresia. But what we found also is like at 12 months of life, any direct bilirubin greater than 1 is an indicator of possible poor prognosis. Similarly, total bile acids has been phenomenal work by Dr. Harpavat and his team, could be a possible prognosticator at like around 5 years. Now, this is all based on already published manuscripts that we've compiled and we've done a meta-analysis on. And thus they are limited by the inherent limitations of the initial manuscripts. And so the truth of the matter is, I think there needs to be more work on serum values as prognostic markers. We look a lot at diagnostic markers, but how can we tell patients if they're going to do well or not? And that's the inherent thing our manuscript tried to address.